Today, we have another interview in action from the conferences that just happened down here in Miami and Orlando. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. We want to thank our show sponsors who are investing in developing the next generation of health leaders: Gordian Dynamics, Quill Health, Tausight, Nuance, Canon Medical, and Current Health. Check them out at thisweekhhealth.com/today. Here we go.
All right, here we are again from Chime and ViVE 2022. We're here with Sarah Richardson. Sarah, silver sneakers.
Yes. Well, these are my Golden Goose sneakers, but brand.
Golden Goose brand, but they're silver.
They're silver, which represents, I can represent my company for silver sneakers for Tivity Health.
I'm sorry, I thought that was like why you wore those.
Why I wore them? No, but you know what? I'm going to use that because I feel like that's awesome. That's a great idea.
No, that's fantastic. So you're with Tivity now.
I am. Almost a year.
Almost a year? Really?
March 15th.
Wow.
Yeah.
A little different than DaVita, isn't it? I mean, you're doing a lot of really fun stuff.
I've done fun stuff everywhere. I don't think it's fair to say that, like, hey, one thing's different
I've
than
been a
another.
CIO. You don't have to lie to me. I mean, there's a lot of, hey, can you move that computer from here to there?
Sure.
Can you set up this new office?
Well, what's interesting about the whole DaVita thing is I went to go work for Healthcare Partners. They got bought by DaVita. They got bought by Optum. And then so you constantly lived in that merger acquisition space, which is great. We all know it. We know how to do it. Tivity was super compelling to me because of how we serve seniors. We do wellness, fitness, social engagement, mental enrichment, the whole continuum of things that keep seniors healthy in the Medicare Advantage space. That's a big deal. That's 18 million members who need all of these different services because the goal is to live a longer, healthier, happier life.
18 million nationwide?
Yeah.
Okay.
74 health plans, 18 million members that can utilize our services for all those aspects of their life. And we keep growing those opportunities and platforms through different consumer engagement opportunities. So it's an amazing thing to be in a company that's so nimble and so capable of drilling in and serving its true customer.
Plus I know it's seniors, but the digital foundation is pretty important if you're reaching a national constituency.
Well, sure, and think about this. People are digitally native even in their 60s and 70s and beyond now because you think about the average 80-year-old, they've likely have been exposed to social media because they want to keep in touch with their grandkids and beyond. And so when we think about these digitally native or digital first opportunities for our seniors, they're not uncomfortable on those platforms. In fact, we've seen 100% growth in the last year just on our Silver Sneakers Live platforms. So it just continues to proliferate from there. So it's pretty exciting to get people involved in things that you didn't normally think that they would, and yet here they are asking for these features in their programs.
So digital, do you have a digital foundation for this, or is there like a Silver Sneakers app, or what does it look like?
There's a Silver Sneakers app. There's also a silversneakers.com website. We are embarking though this year especially, that's why I brought in some really fantastic new talent, both Beth Cooper and Chris Nessett on my team, and they're supplementing people who've already been there for a long time. We're big into MarTech and omnichannel. We're very good at all of those things and the data specifics that go behind that. We're in the process of literally building out a new consumer engagement platform so that we can do guided onboarding, getting in the configuration engines behind that. So your bill, we know who you are. You answer a few questions each time, and then we start to serve up, just like any other platform, things that we know that you're going to like best to do next. So next best action is part of the work that we're doing now.
When you say consumer engagement platform, I hear CRM. Is it different?
It's different. So we have Salesforce for CRM. This is really going to be that engine behind the fact that we know everything, that you tell us, and we've gathered about your services.
You're going to reach me in a lot of different ways.
Yeah, which we have Omni today. But when you go to our website today, it's a website that you can go choose things. Everybody gets the same experience. It'll be our website differentiation that says this, when you come back to our website, it is customized based on the usage that Bill and the things that Bill likes to do.
So you're not dealing with the same data challenges. You're dealing with some, but when you're at DaVita and when I was at St. Joe's, the data on a visit is dirty and a lot of stuff, but you're dealing with really health plan type data and whatnot. Is it cleaner?
Sometimes it's cleaner. Depends on how they're sourced and they come in. Either way, you still have to make sure everything is gone through data governance, data lineage, data quality, so you have the tools for that before you load that golden record into, in our case, Snowflake, to feed Omni. So being able to pull all those pieces together elegantly still requires the same parameters that you needed in any healthcare system because you're still using member data.
So do you have a lot more flexibility? You're not tied to some of the legacy. At St. Joe's, I had 800 applications, 1,600 instances of those apps, and I'm sure at DaVita you had something like that. Are you not tied to a lot of legacy?
We are not tied to a lot of legacy. We have a lot of legacy infrastructure, like legacy coding that we're overcoming, but we've been able to bring in brand new systems and really launch them relatively quickly because we're smaller, we're more nimble. We're a 30-year-old company. we still get to act like a startup sometimes, which has been really fantastic, especially with our new leadership. Richard Ashworth is our CEO from Walgreens. It's been there almost 2 years. He continues to just bring in the people who've done the best of what they've done in the industry. And so we get to go and say, on Friday, we need to do this. This is a really great idea. Go through the parameters and yet start to launch some of those ideas even the following week, because our governance is us deciding, yes, this is the right thing to do.
Have you ever seen a development team before? Because what I'm hearing, you're doing a lot of development.
Huge software development shop now. I have always had software development in my world or in my ecosystem, where it was maybe like a third or 25% of the total team that I had. Now it's like 60 to 70% of the team that I had. So I also love the fact that it makes me focus on new areas and things that I hadn't necessarily done recently. So
Wow.
the reinvention of yourself is constant. And so I'm a big fan of always reinvent yourself. This has been a huge opportunity to do that at Tivity with some really phenomenal talent.
It's a great fit for you because you are into fitness. I mean,
am.
you look great. You've every time I see you are showing off the Peloton and all the stuff that you're doing personally through the pandemic. You're a role model to all of us.
Running a half marathon, training right now. I got my certified personal trainer certification during the height of COVID, because what else was I going to do at night?
Certified personal.
I am. I literally went and got my CPT through National Academy of Sports Medicine, and I'm getting my nutrition cert next. So nutrition now is as much funneled into and wellness and health and exercise as anything else I do. And then if you find Tim Stedheimer, he's already wrote me into the doctorate program for Chime, which I'll start in July. So just keep going.
So you're staying busy. Well,
Yeah.
what are you looking forward to about this conference?
I knew you'd ask that question. I thought about it literally like 2 or 3 times. I'm looking to solve problems I don't know I have from the new technologies that are out there, because there's such a proliferation of the cool things that so many startups are able to go after and look at, and they're not unique to having to work inside the 4 walls of a hospital system. This is our wellness capabilities across the continuum, and so I bet there's stuff out there on that floor that will literally solve things I didn't know was a problem for me, and that's what I'm excited to go find.
Yeah, it's this conference, because it's a combination of health and Chime.
Yeah.
It'll be interesting because the health conference, which I've gone to since the first one in Vegas, is VC, private equity. But on the other side, it's payers, providers, it's pharma, it's big tech. I mean, it's all over the board. And I think you do see the people that used to get swallowed up in Chime, they had a little booth back in the corner, you had to really find them. They're front and center here.
Yes.
So there's a good opportunity as you're just walking around to see some of those. Yeah, good conversations last night.
I have met so many phenomenal people that are tied to the mission of what they do. And now when you ask people about what's your booth or what's your story, what's your company, it's very specific problems trying to be solved in the healthcare realm. That's important, because it used to be these monolithic booths or monolithic organizations that took over all those different pieces. We've moved away from the EMR being the center of the universe, and now it's all the things that bolt on around it. So we had all these disparities, went to best of breed, and now we're starting to spread out again, because it's easy, for the most part, to connect great ideas into the core of your systems.
Sarah, thanks for stopping by.
Always great
Appreciate
to see you.
it.
Thank
Take
you.
care.
Take care.
Another great interview. I want to thank everybody who spent time with us at the conferences. It is phenomenal that you shared your wisdom and your experience with the community, and it is greatly appreciated. We also want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders: Gordian Dynamics, Quill Health, Tausight, Nuance, Canon Medical, and Current Health. Check them out at thisweekhealth.com/today. Thanks for listening. That's all for now.